Hi ladies, as I had alluded to in class, I was going to pick up with a screencast of the remaining material. You'll see as I go through it, we largely covered everything that's to follow in class today. We had a great discussion, so I'm just going to highlight a couple of points so you have them for your notes and you can watch this. So mastitis is a staph infection, but I want you to remember a woman can still breastfeed and should still breastfeed through this infection. Yes, it is going to be uncomfortable. No, her baby will not get sick. We're going to put her on antibiotics. She gets clindamycin. This usually won't happen immediately postpartum. This would be happening a couple of weeks out from delivery. So this is something you'd see if you were in the prenatal postpartum setting of an office. All right, an issue that you will see on the actual labor and delivery floors are variations of normal for nipples. If a woman has inverted or flat nipples, you can imagine that getting a baby onto breast is going to be a little bit more challenging. Not impossible, just more challenging. What we often recommend these women do is set up the breast pump, as I had showed you in class today, and try to pull out that nipple before they latch the baby, because the baby needs the nipple and areola to grab onto in order to initiate the process of milk flow. So with this breast, we'd be working very closely with this baby and mother to try to elicit the nipple beforehand, i.e. with a breast pump. The other thing is a nipple shield. It's a clear plastic device that helps to pull out the nipple and give the baby more to grab onto. This woman can breastfeed, it's just going to take a little extra assistance. The other thing I wanted to say about her is we'd make sure that we're getting a breastfeeding consult. So there's lactation consultants on most of the floors, and you can ensure that your patient gets seen by the lactation consultant by putting in a request for that. So the woman's getting extra support both from you as the nurse and the lactation consultant on the floor. Raynaud's phenomenon, just like you guys know for fingertips, can happen. This is not overly common, but can happen on the nipple as well and have the same Raynaud symptoms that you're learning in med-surg. This is one of the issues. I had spoken to a couple of points where women aren't able to breastfeed or don't produce as much milk. So one is women who've had breast augmentations, women who have severe endocrine issues. This image is of a woman who has gynomastia, and that's male patterned chest. So this is a female chest, but her chest looks more like a male patterned tissue. She doesn't have enough milk producing glands to make breast milk. She may make a little bit, but not enough to fully feed her baby. This is showing us if we just look in Connecticut. You can see the statistics have unfortunately not changed, guys, over the past couple of years. This is from 2012, but there's really not much difference. So for Connecticut, we see almost 80% of people have ever breastfed, but by 6 months, when we know infants should still be getting breast milk as their primary source of nutrition, we're down to only about 50% of babies. Oh, I'm sorry. Only about 50% of babies actually still being breastfed. And when we get to a year where we talked about today, the American Academy of Pediatrics, the AAP, really does recommend that women and babies are still breastfeeding. Only 24% of women in Connecticut are still breastfeeding. So we have a really big job to do, guys, of ensuring that we're providing all the right education for women. The video link that I showed today and posted, really important that you know all those benefits of breastfeeding for both mom and baby so you can educate your patients about that. Who wouldn't want to lose weight? Who wouldn't want to use breast milk when it's free? So those things you can use when you're educating your patients. Common questions related to breastfeeding. We covered these in class today. The first one, I have had patients say to me, because this is a cultural thing, oh, I'm going to throw away the colostrum. It's not real milk. You are going to intervene and you're going to explain the benefits of colostrum that we talked about today. Colostrum is perfect for the baby. That's what their stomach is designed to be getting for those first 2 to 3 days before the milk comes in. So absolutely not. We should not throw it away. How do we know the baby's getting enough? I spoke about today. The baby looks satisfied, is dozing off to sleep afterwards. You may see a little milk dribbling out of the baby's mouth when it comes off the breast. I jokingly call it milk drunk, right, for the babies. And then the other ones we've spoken about today. Making enough milk is obviously pretty much the same signs as the baby getting enough, the baby's satisfied. How long should I breastfeed for and for how often? We said in the beginning about 8 to 10 times a day, and the baby's on each side for about 10 to 20 minutes. But again, I don't want a woman to be wedded to the clock, but these are some parameters you can talk to her about. And we should be teaching women to breastfeed at least for a year and longer as they see fit. And beyond a year is completely recommended as well. She doesn't have to wean at a year. What are the various positions for breastfeeding? These were covered in the video as well. I want to just tell you that the football hold here is really great for our C-section patients, and this lying down position really isn't helpful until the baby is a couple of months of age, just because it's hard for them to have the neck control to do it. This is an example of side lying. This is a baby who's a couple of months old, so I'm just showing you that the benefit is as the baby's older to side lie. You can think that when mom's nursing in the middle of the night, this is a nice easy position for her as the baby is getting bigger. The video covered this as well, right? When you're working with a woman latching a baby onto breast, you want the lips flanged out and you want the baby's mouth to cover not only the nipple, but the areola. If the baby doesn't have a correct latch and is only on the nipple, her nipples will be very cracked and sore. So this image is correct positioning. Again, this is what's happening. The baby's gums are compressing those milk sinuses and the tongue movement is helping to propel out the milk for the baby. We've also spoke about avoiding nipple confusion. So for a breastfed baby, we want to avoid bottles or pacifiers for the first 2 weeks so that the baby is getting used exclusively to the breast. Why is that? If we give the baby a bottle, it can get the milk much faster. It has to work a little bit harder at it at the breast. So we want the baby to get used to that sucking mechanism and understand how to pull milk out from a breast before we're giving him or her the easier way with a bottle. Women who are returning to work will often, even if they're exclusively breastfeeding and giving breast milk, introduce that bottle of breast milk sometime towards the end of the baby's first month of life so that the baby does at that point get used to how to use the bottle, but not in the first 2 weeks. Women will often ask you this about the pacifiers. Again, for breastfeeding women, we want to avoid the pacifier for the first 2 weeks, but we know that pacifiers can help decrease the risk of SIDS. So you want to educate patients that, yeah, after the baby is, doing well with breastfeeding, it is okay at that 2-week mark to try to introduce a pacifier if they'd like to. Cup feeding for women who are really, really committed to breastfeeding. If their baby isn't latching on properly and they don't want to have nipple confusion, you can try to get a baby to drink breast milk out of a cup. It takes a while, but it is absolutely possible. The other option for women is to, if their baby's having a hard time latching or getting milk from their breast, is to do a supplemental system as pictured here. So this is mom's pumped milk going through a tiny tube that is connected to mom's nipple. So the baby's latching and still getting the idea and getting some milk from her nipple, but also not getting frustrated because it's getting milk through this system as well, breast milk of hers. So what's wrong in this image? The baby's bottom lip, guys, isn't flanged out. This would be an improper latch. And as I spoke to you about in class today, you just want to say to the mom, you know what, let's try to break the suction here and try to relatch the baby. Let me show you some ways that may be more comfortable, right? You can start by assessing, is this comfortable for you? And she's going to probably tell you that it feels a bit pinchy. So to get the baby off her breast, this is a huge teaching point. You're not going to just pull the baby out because there's a suction there. You're going to have mom insert her pinky between her nipple and baby's cheek to break the suction and then remove the baby. She should not just pull the baby off. It will hurt her nipple. So pinky in between nipple and cheek, and mom can pull the baby off that way. Obviously the baby needs to be burped, whether it's bottle feeding or breastfeeding. These are various burping positions. First few weeks at home, often the babies will be eating on demand, and that's okay. You want to, teach the mom about breastfeeding, that the more she breastfeeds, the more her milk supply is going to be coming in, and she's going to up her supply that way. Baby will go through growth spurt at 2 weeks, at 6 weeks again, and so the baby may want to eat more during those times, and you want to just educate her that all of that is normal. We also have spoken about most of this today in class, so if there's any questions, please bring them to class, and I will start with breastfeeding questions on Monday when we all meet. So maternal bottle feeding concerns, things that we should be talking to these moms about. We talked about what to do about the natural process of their milk coming in and what to teach them about to do as that process comes in, obviously not stimulate their breasts. We want to make sure that these women are sterilizing the bottles, making sure that they're using clean water obviously and clean bottles each time. Questions, any questions that people have about bottle feeding, feel free to bring on Monday as well. The one point I will say here is, right, even though the baby's being bottle fed, its stomach size is the same as it was for the breastfed baby. So a teaching point is sometimes you'll see a mom trying to feed a newborn baby 2 or 3 ounces of milk. Its stomach is not designed to take that all in. So we're educating mom the same way we were about the baby's size of its stomach. For breastfeeding, we're doing the same for a bottle feeding mom, educating about the size and how much we should be giving. All right, we talked about introducing solids at 6 months, and we normally start with vegetables first, or rice cereal. So rice cereal and orange or green veggies are a really great way to start. Obviously, I mean pureed vegetables. The baby can't chew at this point. And I think we talked about this a lot, and we need to support women through their breastfeeding journey, but it is incredibly possible to still breastfeed throughout that first year, even back at work. This is showing an image as well, right? All possible. And this is what my summer looked like, guys, with my newborn and my toddler. But you find ways to make it all work, even when you have another child. And breastfeeding twins absolutely is possible as well. Moms can make enough milk for twins. Usually twin A will end up on one side of the breast and twin B gets the other side. Usually mom just develops a pattern for which baby has been on which breast last to ensure that they're both getting adequate milk. These are different positioning for twins. And then breastfeeding during pregnancy, you will find that there are patients who are still breastfeeding their older child while they're pregnant. In the absence of preterm labor, a woman can still breastfeed while she's pregnant. If she has any risks for preterm labor, any nutritional deficits, then yes, we would have some contraindications. But a normal, healthy pregnant woman can still breastfeed throughout her pregnancy. Obviously, she has a lot of nutritional needs. So I put this up here. I don't know how many people had seen this when it came out in 2012, but this was, titled, "Are You Mom Enough?" Right? To try to put a public face to breastfeeding toddlers, which, is often done, but people don't do it publicly because it creates a lot of uneasiness as a society. It is perfectly healthy for a toddler to be nursing still. There are still the nutritional benefits for that baby, for that toddler, I should say, to be getting breast milk. So I just want us to think about that if our patient is breastfeeding both a baby and a toddler, to just think about our beliefs before we encounter that in the clinical setting. And this is an example of the toddler and the baby nursing. You want to think about it in the context of just teaching mom to make sure the baby's on breast first to ensure that the baby's getting adequate milk before the toddler goes on. And interestingly, right, mom's body, even though she'd still been nursing this toddler, her body after she had the baby will still be producing colostrum for those first 2 to 3 days. So her toddler may make faces and say, "This doesn't taste right." That's a normal process. And we've spoken at length about this, right? This is the anglosia, the baby with a tongue tie, and this baby would have issues with breastfeeding. And we talked about that tongue tie can be snipped to aid with breastfeeding, but would be challenging in that immediate postpartum period. And I want us to all remember as we're teaching women to keep calm and nurse on. All right, guys, I look forward to seeing you on Monday. I will send an email out about details for Monday, but bring breastfeeding questions, and then we'll jump into our antepartum testing.